యావత్ ప్రపంచాన్ని గడగడ వణికిస్తున్న పేరు కరోనా. కంటికి కనిపించక అదృశ్య రూపంలో ఉంటూనే వేల ప్రాణాలను హరిస్తున్న ఈ మాయదారి మహమ్మారి అసలు ఎంత ప్రమాదకరమో, అది ఎలా పంజా విసురుతుందో, దీన్ని ఎలా కట్టడి చేయగలమో తెలుసుకోవడం ఇప్పుడు ప్రతి పౌరుడి బాధ్యత. కరోనా వైరస్ నియంత్రణకు వైద్యులు, శాస్త్రవేత్తలు ఎంతగానో శ్రమిస్తున్నా ఈ విషయంలో పౌరుల స్వీయ అప్రమత్తమే కీలకమంటున్నారు నిపుణులు. కరోనా చరిత్ర, దానిపై గెలిచేందుకు పౌరులు చేయాల్సిందేమిటి అన్న దానిపై వైరస్ల గుట్టుమట్లు తేల్చడంలో నిపుణులు పీటర్ పయట్ ముఖాముఖిని ఇప్పుడు చూద్దాం.
Why is it called the novel coronavirus?
Oh, novel is just that it's a new virus that we've never seen before. And, our immune system has evolved over 2 million years, but we have absolutely no memory, no protection against new viruses. And that's why it's so absolutely so disturbing.
How easily does this new virus spread?
Well, this virus spreads fairly easily from person to person. And so you get it from other people. And because it's a respiratory transmitted virus.
How is it different from a lot of other viruses that, infect us?
SARS and MERS. First of all, many people who are infected have no symptoms for several days or sometimes at all. And so we don't know how to isolate. And that's really worrisome because you're infectious. That the throat is full of viral particles. And that's how it's transmitted.
How deadly is the new virus?
Well, it kills on the average about 1 to 2% of people as far as we know, but that's really not so useful to know for you as an individual. Your immune system then poorly reacts to any virus, but particularly to this one, and that's when you have other health issues. And so it's particularly chronic lung disease because there is also when you have... the breathing becomes more difficult, and so you need far more intensive care.
Has mankind ever wiped out a virus completely?
Oh yes, there is one. Only one up to now, and that's smallpox, which used to kill millions of people.
Right.
And thanks to massive vaccination campaign. And we are very close to eradicating polio. Let's not forget what a plague that was in this country. Also, thanks to major efforts of the Gates Foundation and many governments in the world, including the US.
How likely are we to come up with therapeutic drugs that push it back in a good way?
Yeah, I'm quite confident that probably in a matter of a couple of months, we'll have, repositioning of existing drugs against viral infections like HIV and so on. They're being tested in clinical trials, particularly in China, but also elsewhere. So we should know in a few months, and it looks promising.
What about antibiotics? Everybody always turns to them in a crisis.
Well, let's not forget, first of all, that antibiotics do absolutely nothing against viruses. That's for bacteria, and even if they're overprescribed. But they can be important when you develop, in addition to your viral infection, some bacterial infection. So antibiotics can have a role, but they do nothing against viruses.
In a hospital. We live in this socially connected world, and people are on the internet all the time. What about all the cures and all the great advice, Dr. Google and the rest of them?
Yes, well, there are, going to be, and there are already endless false alarms all over, and only when you read about it in trusted, reliable websites, such as the ones that I mentioned, CDC or WHO, should you feel confident that this is real science. But most of what you hear is really total rubbish.
Got it.
And so be careful and don't spread the fake news.
So how about masks? We see, masks, we talk, are those blue surgical masks or the N95 face mask, are those useful here?
They're very limited value, I would say. The most important thing is that when you are coughing, when you're sick, to wear a mask to protect others. But even the 95 masks that are pretty sophisticated, they only will block less than half of viral particles, to infect others. So that's not so great. So that, but if you're sick and also if you work in a healthcare setting, then that's mandatory.
Do different viruses spread more easily than other viruses?
Oh, yes. Measles is the worst. People don't realize that, but you can actually get measles by walking into an empty room that an infected person left 2 hours ago. And that's why we have these measles outbreaks when vaccination levels go down. It's very, very rare. The common cold also spreads fairly easily, a lot through hands actually. But on the other hand, HIV is much harder to spread. And yet, we've had already 32 million deaths globally. So over time, it's also as bad.
How long will it take the new virus to spread through a population the size of the United States?
Well, in the absence of major measures, we know that it takes about 1 week for this virus to double the number of people infected in a population. And use this very simple math. That means that it takes 3 to 4 months to move from 50 infected persons to 1 million. That's the simple arithmetic of contagion. But that's, of course, the worst-case scenario, and we can do something to slow it down.
So is a fever, we see those thermometers all the time, a good way to identify infected people? What percentage of the people who tested positive in Chinese hospitals came in without a fever?
Well, about 30%, 1 in 3. So fever is imperfect. As I said, it's coughing. That is the number one symptom. And so screening just for fever lets a lot of infected people pass. That's reality.
Is it likely to come back in waves, Peter, like others have?
Yeah, probably, although nothing is sure. But first of all, the Spanish flu 100 years ago hit the world in 3 distinct waves. And it was the second wave that actually killed most people, more than in the whole of World War I. But we don't know how this virus will behave. And for example, the reopening of factories and schools in China may lead to a second wave. And let's see.
So it appears that people, after they recover from the virus, they could still be contagious? Is that true?
Yeah, that's been documented, but we don't know how frequent that is, and so more research is needed for that one.